all registrants when it's available. And I want to thank you today for attending our webinar. To find out more about this webinar and about MASBAC in general, please visit our website, www.masbach.org. So for those interested in receiving nursing CEUs, we do have a few conditions that must be met. So you must register for the webinar. So if you're here, check, you've done that. You also must participate in the entire webinar, no scooting out early. And the most important one is you must complete and submit the evaluation form that will be distributed via email a couple days after the conclusion of today's presentation. So in order to receive the certification of completion, you must fill out the conference evaluation that you're going to get a link to via Survey Gizmo by 3/19/21. After that, it goes away. I am happy to report there's no conflict of interest of any planner or presenter of this activity today. So let's begin by introducing Lynn Muller. Lynn is an educational specialist for student services and school counseling at the Maryland State Department of Education. A school counselor, educator, supervisor, and presenter, Lynn has shared information and knowledge on a number of topics related to school counseling and the needs of students in school. Lynn is a Maryland licensed clinical professional counselor. She is nationally certified counselor and has her doctorate in counselor education and supervision. She's been presenting on the topic of sexual minority youth and equity issues for many years. So without further ado, I'm going to turn the controls over to Lynn.
So as soon as you stop screen sharing, it looks like I can share my screen.
Okay, you got it.
Thanks. Let's see. All I have to do is find out where
On the bottom?
There it is, share screen. Sure, the big green thing, it says share screen, that one.
Correct, that corrects, that share screen.
That one. All right, hello everybody. Does this look like it's working?
Yeah, if you could do the slideshow, your screen will, your slide will fill up. But yes, I can see it.
Thank you. Slideshow from beginning. Okay, that should do it. So
Awesome.
It's correct?
Correct.
Kathleen? Great.
Yes.
So welcome. I'm gonna, you've heard my introduction. This is love work, like you do your work that you love. Counseling and related issues for our kids in schools has been a great love of mine for a real long time. And I'm honored to be here with you today to talk about this topic. I could talk for 5 hours, but I promise you I won't. But I will be moving fairly quickly through a lot of the first pieces because it's really about shared vocabulary. And you all know that whenever you're talking about a subject that could be sensitive to many people, you want to make sure you have a nice, safe, shared vocabulary so people don't feel freaked out about, oh, did I use the wrong word? So I'm going to start with sexual orientation. I'm sure everyone here knows what it means. I've just put it up here. I think the biggest mistake we made with sexual orientation, and not we, but the literature made, was to not call it romantic orientation, because it has less to do with sex than it does to do with romance, who you're attracted to, who you want to be with, all of those romantic things. And of course, in our country, if you say sex, people get all freaked out and, oh my God, they're talking about sex. When in fact, sexual orientation is really about who do you love. I think you know the term heterosexism or heteronormative, and that's assumption several people have, that all children, they just assume, just sort of like a privilege, like white privilege, that all children are heterosexual and that being straight is normal. You know, by definition, a lesbian is a woman who is attracted to women. Gay, we tend to use as a more umbrella term. It really is a man who's attracted to men. But we tend to use it as, when I talk about my kids in school, I talk about my gay kids, and I mean my gay, lesbian, bisexual kids, and sometimes transgender kids fall into that same term. Bisexual, you're familiar with, someone who's attracted to both genders. After reading lots and lots of literature, I had one of my kids, this is when I was still a high school counselor, say, oh, this is easy, Mrs. Muller. I'm just attracted to a kind of person, and I don't care whether they're male or female. I'm just attracted to a kind of personality. Makes sense. Pansexual, someone who's attracted to all gender identities. I'll get into that in a minute. So these should be very familiar terms. And if they're not, it's just that it's not something you use all the time. You all know probably better than anybody about gender assignment at birth. And it's usually, somebody looks at a sonogram and says, oh, if you want to know, this looks like a little boy or this looks like a little girl, and how the baby's defined, how sex is defined at birth. That's the assignment. Gender identity is very different. Gender identity can appear very early or later in a child's life. It can be clear and stable, but it can be very fluid too. And it's your knowledge of your own gender, your absolutely deeply held sense that you are male, or you are female, or you are both, or you are neither. Regardless of what they told you, the doctor said about you at birth. It's your knowledge, it's an internal sense of knowing who you are. Gender expression, we all have our gender expression, how we express our gender, such as clothing and hairstyles and so on. And I always kid about this one because sometimes on weekends, my expression is much more masculine, although I identify as female. My expression is much more masculine. I'm wearing jeans and a sweatshirt. And if I'm working on the house and I have to go to Home Depot, I might be looking a lot more masculine when I get in the truck and drive it over to Home Depot. So gender expression is really how you express your gender, but that it doesn't change what your gender identity is or what your gender assignment is. It's just how you express it. All of you know kids who express in a different gender than they identify, but it doesn't mean that they are a different gender. And then we have terms like gender variance, gender spectrum, gender nonconforming. You'll hear a lot of these terms all through this presentation and as you talk with and about kids. But generally speaking, we're talking about when interests or behaviors are different than what we culturally expect of our kids. They're different than what's sort of culturally in the norm. Again, I'm going kind of quickly because I think you know this. Non-binary, the kids used to use the term gender queer. That's not a term I used to use. We see non-binary more often as sort of a catch-all term. And generally what it really means is a student who says, I'm not really male and I'm not really female. I might be both, or I'm not either, or I'm moving between the two genders, and they may have a fluctuating gender identity. That's the term non-binary. If you haven't ever met the genderbread person, I did not make this slide, but I wish I had because it's pretty cool. What it says is gender identity is either male or female. Male, you identify as either a woman or a man, or somewhere in the middle. They used to use the term gender queer. And it has to do with your brain, your knowing of yourself as either female or male, or somewhere in between or both. Your gender expression has to do with is either masculine or feminine, or androgynous, meaning you can't tell by looking, is really about, come up here. It's really about your body and how you move your body, how you use your body, how you express your gender, either with clothes or with motions or with hand gestures or facial expressions, whether you appear more feminine or masculine. If you've worked in schools with little kids, you often see androgynous kids whose parents name them something like Zoe, so you still don't know whether they're male or female. But they're kids who you can't tell by looking whether they're male or female. They're not trying to be one or the other. They just have that sort of androgynous look, especially when children are younger. Biological sex, biological sex, let me go back here, is about male or female, because that's the sex assigned at birth. And then, of course, you all know that there are intersex births, about, I think it's 1 in 1,000 kids who can be identified as intersex. I'm not going to get into that one because that's a whole different presentation. And so when we talk about biological sex, we're usually talking about genitals. How are you defined at birth? And sexual orientation, I've already mentioned, heterosexual, homosexual, bisexual, has a lot to do more with your heart than anything else. So gender identity is in your brain. Sexual orientation is in your heart. Your sex is usually defined by genitals. And your gender expression is how you put this all together and what you wear and how you act, how you talk, how you move, all of those things. So what we know is it's sort of a roll of the dice kind of thing. You might be male at birth and your expression may be male, and your identity is male. We call you cisgender. And I'll show you that term in a minute. You might have been assigned female at birth, express female, and identify as female. But the roll of the dice might be that you were assigned male at birth, you express as female, but you identify as female. Could be. Any of those things are possible. You all know the wide range of normal in people's behaviors. You might have male at birth, expression is female, but still be male. You might have female at birth, expression is male, still be female. There's all kinds of combinations of gender identity and gender expression. They're not all related to each other, and I'll tell you more about that in a few minutes. Probably the students that you are seeing more often now than we used to be seeing were our kids who identify as transgender. And what you have here are pictures of folks, you may know something about. This beautiful woman here was shot in her car, was enraged when they found out that she was transgender. The murder rate for African-American transgender females is scary high. It's not good for anybody, but it's really high for our African-American transgender females, identify as female and may have biological male parts. Let's go to the next one. So transgender youth, again, transgender is a sort of broad term of category of people whose gender identity, what the doctor said at birth, differs from that associated with their birth sex. So they may have been born male, but identify as female. They know that they are not, the genitals don't match who they are. This is not a transient thing. I know it today, I don't know it tomorrow. That might be a non-binary issue. Our transgender kids know, and they know long and hard that they are not a boy or they are not a girl. I'll give you an example of that in a few minutes. They may be transsexual, moving from male to female or female to male with or without the help of hormones or surgery. So it's possible you're male at birth and you are slowly changing your gender expression to be more female because you know yourself to be female no matter what your body's telling you. Sometimes our kids use hormones, and I'll talk about that in a few minutes, or surgery. Some have sex reassignment or gender reassignment surgeries as they get older. Not all do, and that's really important. Not only that, but not all transgender people who identify as different from the sex assigned to them at birth, not all of them are moving from male to female or female to male. They're parked somewhere in the middle, and they're not identifying as either transgender male or female. It's a good place for non-binary to fit in. They're parked somewhere in the middle, and they reject being either male or female. So it's obviously complex. There's no question about all of this being complex. And the bottom line is our kids will tell you what they believe to know and what they know about themselves. If asked with kindness and compassion, they'll tell you how they identify. You'll hear the term transgender or trans. Again, you've got this umbrella term for any person whose gender identity differs from their gender assignment. Cisgender is what the large majority of us listening to this are, meaning our gender assignment and gender identity agree. I was born female at birth, and my gender identity is very much female. My gender expression is very female, except on those weekends when I'm doing like bull board and stuff. Many of our kids are stealth. They know themselves to be transgender, but they're not choosing to share it with anyone. Thank you very much. And they have the right to do that. They know it's not always safe to come out, and it's not always safe to come out to people you think it might be safe to come out to, so they're stealth. They stay under the radar. Transitions, you'll see more of this in schools, and I suspect if I could see you and we had time to chat a little bit more, I would say how many of you have seen this social transitioning, because that's what we tend to see most in schools, where the child says, I was born female, or they don't say this formally, I was born female, I identify as male, I want you to start calling me Brad instead of Barbara. So they change their name or pronoun. I identify as she or her, and start changing their dress and hair or their presentation, their gender expression to more closely match how they identify, what they know about themselves. Some of our children undergo pharmacological transitions where they will, hopefully with the help of doctors and nurses and all of you, you wouldn't be prescribing this, but you might know of it, where they block hormones of their birth sex and apply the hormones of the identified gender. This is a pretty powerful thing that happens with our kids, because if you're born female and you reach puberty and you start having your period and you start developing breasts and your hips flare out and you know yourself to be male, it's like the most horrifying betrayal your body could possibly do to you. And there's nothing you can do about it unless kids bind themselves down and do some pretty painful things so their body doesn't look, in this case, look female, even though they're biologically female, but they identify as male. So they try to get a hold of hormones that will slow that down a little bit. Let's block some of that estrogen, and then let's add some testosterone. And if they don't do this through the medical field, they do it through the streets. And that's one thing that we really want to be careful about and watch with our kids and talk with them about, is if they're taking medication, if they'll tell us that's not legal, where are they getting it? How safe is it? And help them get it in a way that's much safer. Often they have not told their parents wouldn't approve, so they just buy stuff on the street. And all of us know what happens when you buy stuff on the street. You get all kinds of crap. Some of our transgender folks will have top or bottom surgery to correct the effects of the wrong hormones, breast removal. I won't go into great details, but usually this is when they're a little bit older. There was a time when they actually left the United States to have these surgeries because other countries were doing them a lot more often and a whole lot cheaper than that were being done here in the States. Now in the States, many of the providers will cover this kind of surgery. That's only happened, I think, maybe the last 10 years or so. I had a parent who told me that they traveled to India to have this bottom surgery done, and staying in India, having the surgery, renting a room, staying there for 2 weeks for follow-up was cheaper than having it done in the States. And that was about 15 years ago. So one of the questions that you will find often is about pronouns. Our kids will use pronouns that are, I identify as male and I go by he or him. So we always want to ask them if they, if we know, or you can just ask everybody, what pronouns do you use? You'll find that more and more at meetings now. Dan Lynn Muller, he, she, hers. Those are the pronouns I use. And so more and more people are just saying volunteering their pronouns. For our non-binary kids who identify really as male, female, might be either or both, may often use the word they as a pronoun. Or they can use she, her, or he, him. So the bottom line, if you're not sure, ask. Just ask any kid, what pronouns do you use when you talk about yourself? What do you use? I'm hoping that everybody here knows this. These are this is a really important point. The gender identity has nothing to do with sexual orientation. They are very, very different things. Gender identity is about how you identify yourself as either male or female or neither or both. That's your gender identity. Sexual orientation has to do with who you're attracted to. Two very, very different concepts. They are not necessarily related to each other, and they're not really related to each other at all. So that's a really important separation. And we want to, as you work with faculty or staff or whoever you might work with, help people understand that just because someone was born female, identifies as male, and is attracted to females because they identify as male, even though they were born female, does not mean they're lesbians. And the bottom line is, if you have to work that hard to try to figure it out, you got to stop doing that. The kids will tell you who they're attracted to, and they'll also tell you how they identify. Some of our kids are questioning. When you saw LGBTQ, the Q is for questioning. They know that they're not male or female, or they may know that they're not the gender of their birth, but they're not sure yet how to identify. That's perfectly normal. It's a process, like everything else is a process. So I have a little activity for you, which you can do in the chat room pretty quickly. There's a bunch of words at the bottom of the slide. It starts right down: lesbian, male, long hair, and so on. And see if you can determine which word fits in which of these categories. Does that word fall under the category of sex, which we know is sort of genital, gender identity, which is your knowledge of yourself, gender expression, which is how you express your gender or your gender, with your gender identity, and sexual orientation, who are you attracted to in terms of love and caring. It's possible that some of these words will fit in different categories. Don't be freaked out. This is not a test. So for instance, if we pick the first word, lesbian, that's going to go under sexual orientation. So it would go in this under D, sexual orientation. You may say it fits somewhere else, but that's okay. This is not an argument. This is just a kind of pause and check in. So for a few minutes, go in and pick, just pick like 3 of these, your choice, and put the word, let's say long hair. You say, oh, long hair. Oh, that's got to be whatever. I'm going to put that in C. So pick like 3 or 4 of these, maybe 3 from this list down here, and then put the word like lesbian and put the letter you think it would go with. So lesbian would go under sexual orientation. I'm going to stop talking, give you just a couple minutes, play with this.
So Lynn, I have a question as a participant. Could there none of the above be an option for some of these?
It's possible.
You just want us to pick 3 that would actually, we
Pick
think
3
would
you're
be-
comfortable. You say, oh, I think I know what this is. And don't worry about it. This is just a kind of separating identity, expression, sexual orientation, and sex, separating them out from each other. And thanks for asking. Barb, I think you're doing the chat room. I'm going to just give another minute or 2 because of the time, and we'll see what we've got. So another 30 seconds or so. It's like only about 8 people have responded. Don't be shy. This is not an exam. And because you can multitask, I'm going to move on to the next slide, which deals with this. Feel free to continue. If you want to write something in the chat box, feel free to continue. So the next slide shows possibility of where answers could have gone. For sex, male, female, and genitals probably makes sense to all of you. That's, sex at birth kind of thing. Gender identity, the words male and female can go lots of places, but people identify as male, female, transgender. They might use the term gender queer. I'll come back to two-spirit in a few minutes. These things often are gender expression, how your hair looks, makeup, that androgynous, neither male nor female. Gender nonconforming can go a lot of places, but your body posture, how do you hold your body? Do you hold it away like women hold their bodies or like men hold their bodies? And then sexual orientation, put heart in here, attraction. So those words should make sense to you. Two-spirit, I don't know if anybody knows where that comes from. If you do, turn on your mic real fast and tell us. I'll give you a second or 2.
I'm guessing, is it from Native Americans?
You guessed perfectly correct. Thank you. They often talked about gender identity or sexual orientation as having 2 spirits. Just think about how lovely that is as opposed to sexual orientation or transgender. It's a soft land. So if you hadn't picked yours to go there, don't worry about it. This is just a kind of check-in. I'm going to keep moving. So many of you are familiar with the DSM-5. The DSM actually moved. It used to be a gender identity disorder in the DSM-4, and they changed the term to dysphoria, which is a low-level depression. It's not a disorder anymore, and it had to do with the depression because of the mismatch between your body and your internal sense of your own gender. It's not a mental illness anymore. What it is a low-level depression. the stress, the anxiety that goes along for some of our kids with being transgender. Because you can imagine if your body, you know your body as well, if your body doesn't reflect your true gender and who you truly know yourself to be, that can cause so much distress and anxiety, and sometimes leads to depression and feelings of dissatisfaction, restlessness. You know, it can be pretty intense. And of course, it can, of course, affect our kids, how they perform at school or at work. And then if they're misnamed, suppose a student says, you know, I'm identifying now as Brad and not as Barbara. The teacher insists on calling them Brad. Every time they hear that misnaming, because it doesn't match who they know themselves to be, they lose learning time, they lose focus. You can all read this. You can see that we're talking about manifested by 6 or more criteria for at least 6 months in order to be diagnosed through DSM-4/5 as having a gender dysphoria. There's lots of data and research. The Academy of Pediatrics is really clear about the fact that our kids can know very, very young, because their awareness of being a boy or girl really begins early. And by age 4, gender identity is stable. And they know they will always be a boy or a girl. And by kindergarten, things are really well established. And so they may not have the words for mommy calls me a boy, but I'm a girl, until they have words. And you will see it in behaviors with our little kids. I'm going to see if I can show this next slide. I'm not sure if it's going to come up. Janet Mock talks, this is just a brief piece, talks about her experiences as a child. We'll get past the commercial.
This is the checkers game where grandson and granddad.
This will be up in a minute.
I love how you say that I can't pinpoint to a pivotal aha moment.
So Lynn, we're seeing the first slide.
Rebuttals and certainties of those around me who told me through
You're
a
not,
slightly
are you
feral
hearing the
growl.
sound but not seeing?
Yes.
the-
I'm hearing the sound.
I'm going to come out of this because that just means it's not going to work. I'll leave this on here. It'd be really, really good to yeah, it kicked me right out. Okay, let me get back to it. Be right with you guys. So that answers the question about using PowerPoints. That's just lack of experience with Zoom, guys. Lots of you use PowerPoints. I'll be right with you. Want to back up? Wait a second.
You may have to reshare your screen.
I'm going to do that as soon as I get to this. Thank you. As soon as I get to the slide I want. I don't want you to have to sit through this whole thing again. And it's being ugly. There we go. That's interesting. I may actually have to get out and come back in. Are you seeing anything or a blank slide?
We see the first slide.
Okay.
Now we see the first slide.
And I don't want you to see that. And
So if you get out of slide view
yeah,
and go either into the preview, you can see all the slides on the
yeah.
left side. Okay.
let me escape the slide view. There we go. Sorry, guys. We want to go to, and I can't see it because it's talking to me. Let me go to view. There it is. Normal and down to,
There.
yep.
Okay.
Are you seeing my screen?
Yes, we do.
All right. And slideshow and from the current slide. Okay, are we good?
We're good.
Thank you for your patience. Okay, so we won't see Janet Mock, but you can watch her yourself. It's very short, it talks about how she always knew she was different. And she always knew that she was a girl. She was a firstborn child, male child in her family. So you can imagine how that went over with her family, but really very personal. So health risks, if you could, again, in the chat box, Identify one or two health risks that you think lesbian, gay, bisexual, transgender questioning students might experience. Just jot down one or two real quick, and or that because you've worked with our kids. What are some of the health risks? So Barb, I think you're doing the chat. Would you start reading some of these for us?
I can read it.
Okay, thank you. Thank you.
Eartha mentioned bullying.
Mhm.
Lipa said depression, self-harm. Barbara said an eating disorder. Case so far said depression, bullying again. Melanie, bullied, violence, suicide, depression. Marguerite, and suicide, depression. So suicide and depression seem to be the winners. Emotional issues, Manjula reported emotional issues related to identity crisis and STDs.
Boy, you nailed it. Excellent. Thank you so much. So move to the next slide. And you mentioned so many of these, and you actually mentioned more than these. We know that there's a higher prevalence of rates of obesity. As you know, some of our kids eat when they're unhappy about the bodies. And so we see more things related to heart disease. There's cancer, but that's sort of related to HPV, as you know, for homosexual activity, and not just homosexual activity, but any HPV infections. You mentioned mental health, you mentioned depression, suicide, anxiety, all of those issues are absolutely correct. STV, HIV, I mentioned HPV, syphilis, hepatitis, violence, injury. And I'm going to go into some of these, not all of these, but you can imagine that our kids are just at high risk for so much, so many things. Bullying is certainly a special one, which we'll get to in a few minutes. You all know that there's been success in reducing HIV rates, but there's been a little bit of an increase, of course, with our younger kids. They just think that we've solved this whole problem and that they won't, how invincible our kids tend to think they are. So we want to make sure that safe sex is being practiced with our kids. We know that our kids are more likely to engage in risky sexual behavior. My kids, I ran a couple groups with gay, lesbian, and bisexual kids before we knew much about transgender kids, because I've been out of the school system for a while at the State Department, away from kids. But they would talk about the fact that the only place to meet people like them were bars. And so my 16 and 17-year-old kids would be going into Baltimore to bars to meet other gay men or lesbian women. And so, of course, it's extraordinarily dangerous and lots of risky sexual behavior. And you can say, of course, what that means too. They probably won't come for help if they are not out, because they're afraid to. They're afraid what you might say, or someone might disapprove, or if you might have to tell their parent. And of course, you all know about confidentiality, but the kids don't always know about confidentiality. And so they're often nervous to even say anything about it. I mentioned transgender violence earlier, and I could talk about bullying and a lot of other things, but I kind of took some of that out. But we know that our transgender kids are often victims of violence and sexual assault. I'll get into suicide in one of these scenarios that we're moving into. So you absolutely named the most important mental health issues for our kids. So for scenario, we're going to do the first one together, and then we're going to have some polling that Barb's going to put in the chat room. So here's a scenario, pretty typical. A few girls are being teased in the girls' locker room. An aggressive girl who's out about her sexual orientation, meaning she's telling everybody she's lesbian. She's been teasing the other girls and making sexual comments to them. So the girls, of course, come to you for help. So as you think about this, I'm not going to poll this one, we're going to do this one together. you think about this, you think, wait a minute, this is familiar. Because if it looks like harassment, it probably is. This is pure and simple harassment. It's bullying and harassment. We have forms to report bullying and harassment on. The girls can report it. You can report it. This is behavior we do not let happen in schools. As soon as we know about it, we need to do something about it. So there's always questions, and this is really helpful advice when you work with administrators of schools, is to help them separate behavior from sexual orientation or gender identity. It doesn't matter if this is a lesbian girl being nasty and bullying other girls, or whether it's just a kid who's harassing other kids. So help them separate the behavior from the sexual orientation, because sometimes people get all enmeshed and, oh, we have this lesbian girl and she's doing this. It doesn't, it's the behavior we look at, not the gender orientation or the sexual identity, sexual orientation, not the gender identity or sexual orientation. So the question is, would you allow a boy to hit on girls this way? No, you wouldn't, or to make those kind of comments. You know, and so there's questions about who can kiss in the halls. Do you let heterosexual kids kiss in the halls? And you've got to let everybody who wants to kiss in the halls. Do you let them hold hands? Do we let girls wear eyeshadow? If we do, then we need to let someone who appears to be male wear eyeshadow. Does it disrupt the education of the child? Probably not. Just pulls people's chains. Do we let students dress in jeans and sweatshirts? If we do, then we have to let both boys and girls dress in those kind of things. So help people separate behavior from sexual orientation or gender identity. Get that out of the mix. And of course, bullying behavior we don't allow of any kind. We have lots of ways to deal with that. So here's the first one.
So Lynn, before you jump into the deep water, I just want to give the participants time to get into the Menti app that we can use for polling if this is the right time. So to all of our participants, if you could go to the chat from Barb at 3:15 p.m., you'll see a hot link to the Menti app where we will be able to collect your polling. And then as Lynn goes through it, you can be navigating that site, okay?
Thank you so much. So here's the scenario. I'm going to read it to you, although, yes, go ahead.
I'm going to add it again
Okay.
so that people don't have to go back.
Okay, thank you, Barb.
That's great, Barb. Thank you. So here's the situation, because all of these are real situations, by the way. Student's been sent to you to use a health suite bathroom at school. Most of you, you know, you work near the health suite or you work in the health suite, but either way, she's been told she has to use the health suite. She's an affirmed girl, means she's biologically male, but has affirmed herself as female and has done that for a while. She's presented as female for several years, uses a female name and the pronoun she. She insists she be allowed to use the girls' bathroom and not the one in the health suite, since she identifies consistently as female. The principal and a few teachers feel she's causing a disruption in subordination now that she has developed. So this girl, all through elementary school, identified as a affirmed girl, used the she pronouns in her name, a female name. But now that she's gotten into middle school, this is a true case. The principal, people are feeling uncomfortable because she's now developed, so to speak. And as they said, a safety threat by insisting on using the girls' bathroom. Okay, so she's biologically male, but she identifies as female. The principal comes to you and says, I want you to take care of this. So in the Menti, is that the right word? You are going to pick any of these answers that you think are the best answer. And you may pick a combination or other. So if you'll do that now, are you going to talk her to using the bathroom in the health suite so that she doesn't get in trouble? You're going to counsel her so she understands the administrator's point of view? Are you going to advocate for her to use the girls' bathroom? Are you going to talk to her about being safe in the girls' bathroom, or are you going to do something else? And Kathleen,
Kathleen.
Kathleen, as this comes through, sort of let's see what sounds like we're saying, most of us are saying.
Lynn,
So-
I will share my screen.
Okay. Do I need to come out?
I believe so for a minute.
I hope I can come out for a minute. Okay, let's see what happens.
You just go to the top and say, stop sharing.
Yep, Yep. Okay, Barb, you're on.
We're waiting for some responses.
Okay. Remember, you have choices. Of course, now that I took my screen down, it might be hard to remember what they were. A was talk her into using the bathroom in the health suite. B was counsel her so she understands the administration's point of view about her safety. C, advocate for her to use the girls' bathroom, not in the health suite. D, talk to her about being safe in the girls' bathroom, or E, something else.
So one question I have, Lynn, is who is the target of this advice? Is it the student?
The student, talk her.
Student. Okay,
Barb says, I had a different, something in the Menti. I'm not sure what
it's
it,
fixed now.
okay.
It's fixed.
It's 75% of the folks said advocate for her to use the girls' bathroom. And 25% have said talk to her about being safe in the girls' bathroom.
Excellent. Okay, great. Now I need to have you stop sharing and I get back to
Yep, we're just going with yours. Yep, we're all set.
for a minute. I'm not. Okay. So let me get from the current slide and tell me, is it back up? Yes, right?
I don't see it yet.
You don't?
No.
Okay. Sorry, guys. This is so slow. Let me share it. Lost my ability to share it. Share a screen. There it is. Here we go.
There you go.
And we'll get from this slide. Current slide. Okay, so we do know that there are titles and laws that say that the transgender students should have access to gender segregated activities and areas. They should be able to use the restrooms with which they identify, the locker rooms with which they identify, be in PE classes and sports with which they identify, intramural sports and interscholastic athletics. And I'll talk to you about more often than that, a little bit more about that. The National High School Federation and the National Collegiate Athletic Association, NCAA, develop guidelines around transgender student athletes so that they can have opportunities to participate in school-based sports programs. Generally speaking, most athletic programs have no particular policy governing inclusion of transgender students, and most coaches are really not prepared to accommodate transgender students, but school systems and athletic associations for schools say that transgender students should participate in sports with which they identify. So here's the Maryland Public Secondary School Athletic Association guidelines say students must be allowed to participate in a manner consistent with their gender identity. And that's for sports. There is case law about bathrooms and case law about locker rooms. And in all cases, they've decided with the transgender student that they should use the locker rooms and bathrooms with which they identify. We know that our transgender kids have alarming rates of harassment. And you can see physical assault, sexual violence, and you can see where that comes from. Lots. It's very difficult for our kids to be transgender. But we also know Title IX prohibits sexual harassment and discrimination based on gender or sex stereotyping in every jurisdiction. In Maryland is a jurisdiction, and that we have First Amendment rights that protects free speech and freedom of expression, including expressions of one gender identity. Title IX's been jerked around a little bit. President Obama put out a letter saying the Office of Civil Rights made guidance that said it was clear that transgender students are protected from discrimination under Title IX. And then President Trump rescinded that letter, and we are sure that President Biden is going to put it back so that transgender students are absolutely protected from discrimination. It got into the nitty gritty of how do you define sex. And so it's been back and forth, but in school systems, we make sure we don't discriminate against kids based on sex stereotypes or based on sex gender identification. The Annotated Code of Maryland model policy talks about bullying prevention related to gender identity and sexual orientation, mentioned specifically in our school code of Maryland. So here's another one. You have a student who's just returned from school from running away from home for a second time in a month. And if you haven't met this kid, you will. As a counselor, saw a lot of this. He says he'll run away again because he's gay and his parents are verbally abusive and they refuse to let him have any friends at his house. They tell him he deserves the bullying he's getting at school and he's not to tell anyone else that he is gay. They've grounded him for being gay and insist that he pray to be changed. Took the words out of my mouth. So here's the poll. Do you A, report the parents for mental injury, which is a kind of abuse? Do you help the student complete a bullying and harassment form since they said they've been bullied? Do you ask if you can share this information with a school counselor or school social worker so they can work with the student? Do you call the parents and talk to them about the harm they might be doing to their child? Do you refer them to the PPW or school social worker? Any or all of the above? Pick which ones you like or some other thing. So I'll leave this up while you fill in.
Lynn, I will just read you guys the results to save some time.
Yeah, thank you. It likes to
So we
bounce.
don't go back and forth.
It likes to bounce me out.
I know.
It's okay. Whenever you're ready, Barb, because of time, I want to.
Yeah. We don't have any responses yet.
Well,
I see a couple in the chat box.
what are you seeing in the chat box?
2 Bs, 2 Cs, 1 D, 1 E.
Okay.
Oh, I'm sorry, there were more. I'm sorry, they're all. A lot of Cs. I think Cs win. C and E tend to be the favorites.
Good.
Yeah. B 30%, C 30%, called parents 10%, 31% for refer to the PPW.
Excellent. So there are no wrong answers here, particularly guys. It's possible you could report the parents for mental injury if you're aware of that caveat in child abuse reporting. If the child's behavior has changed or functioning has been changed because of this abuse that the parents are punishing him for being gay, it could be reported to Department of Human Services for mental injury, Department of Social Services. All of these are things that you could be doing. Calling parents, you might want someone else to do that if they have a relationship with these parents, but that's going to take some fine-tuned work with your school social worker, or school counselor, or PPW. So it sounds like that's exactly what you thought. What we know is that family rejection is absolutely deadly. And this is the kind of information that we could share with parents who are struggling with the fact that their child might be gay, lesbian, or transgender. Just the suicide rate is significantly higher than kids that are not LGBT, and depression is higher. Use of illegal drugs, because our kids are going to self-medicate to deal with the pain. And we already know about HIV and sexually transmitted diseases. Any of these behaviors increase the health risks of students. I'm not going to read them to you. You could write this yourselves. You know this. We don't get into the religious piece at all. That's between families, but we do know that those are behaviors that increase health risks. So sharing information, even if the parent is not really willing to look at it, at least we try to communicate these things. We also know that kids are kicked out regularly. About a quarter of our LGBTQ youth are forced out of their homes. It's because their parents are don't like the, not in my home, you won't do that sick stuff around sexual orientation and also around gender identity. And so you're 13 or 14, you get kicked out of your house, you have no job, no money. What are you going to do? You're going to out on the street. You're going to either sell drugs or sell your body because don't really have a whole lot else to do. So many resort to prostitution. And of course, then you get HIV infection rates. So you can see how many of our kids not only were kicked out, but had physical violence at the hands of family members, about a third of them. And we know that our LGBT youth make up a disproportionate share of the foster care pool. And then they often have, so they come from high levels of violence and rejection by their family, and sometimes are faced with the same kind of treatment by foster parents or foster siblings, and sometimes by people who are supposed to care for them. That's not true of all foster families, of course. I'm not trying to make that generalization. Okay, out of respect for time, we have Ronnie coming from a hospitalization for an attempt at suicide, and he tells you he's feeling depressed again, and you're going to probably do a bunch of these things. As a counselor, I immediately contact the parents and let them know and have them come and take this child to get some kind of help right away. So probably A through D is good, but most important is in Maryland, we have to make sure we contact the parent right away. I'm just telling you this because I want to get through this quickly. The suicide statistics won't surprise you. Our LGBT kids are 2 more likely to actually have a plan, a real plan, not just thinking about it. 3 times more likely have made an attempt prior to when they're telling you about it. And about 50%, it's actually 47, I think, % of our transgender children have attempted suicide before the age of 20. 50%. This is serious work we have to do. Okay, and we have a bunch of community members getting on Facebook, and then they send you messages because they've heard that, oh my God, you have a transgender child in your school, and they are not happy. They're worried about the safety of their own child. You know the answer to this one. You're not going to tell them anything. You're going to let them know that you can't discuss students who are not their own with anyone. And you would advise them to talk to the school administration if they're worried about their child's own safety. You know, their child could use the nurse's bathroom if they're worried about what happens in the bathroom. We always protect the student's privacy. They have the right to share their gender identity with whom they choose. They may tell the counselor, who has no obligation to tell you as the nurse. They may tell the nurse, and you don't have an obligation to tell the counselor. You can ask the child if they want the other person to know, but the child says, no, this is their information. You know about this with HIPAA. This information belongs to them. And so we don't disclose information. So we say this kind of thing to parents who might be worried about their own child. We have lots of policies in place to ensure privacy. So recommendations: behavior doesn't equal identity and vice versa. We can't tell by looking, obviously. Disclosure belongs to the client. Clients don't tend to trust agencies, schools, hospital, other healthcare or mental health care providers because they don't know. So you might do something to communicate that you're gay friendly, put up a rainbow flag, some way to let the kids know you care. You know, if you're involved in any kind of school-wide issues, let's talk about gender-neutral dress codes for ceremonies and dances, and gender-neutral bathrooms, posting rainbow flag or welcoming notices or safe zone signs. You can get, I'll give you a place where you can get a lot of this stuff. There's lots of resources, Listen, PFLAG, LGBT community centers, lots of stuff that you can just simply say without saying that you are a person who can help. Okay, there's 3 minutes left, so I will be glad to take questions if that's okay with you guys.
So Lynn, one question I have is, can you direct us to some resources where we can learn more about the sexual behaviors of these different groups of kids? Because all of us individually probably know a little about X, but it's difficult to counsel on sexual health if we don't really understand the sexual behaviors associated with what the kid identifies as.
Well, and I'm gonna say I can get that for you. I don't have that because I'm a counselor. I don't deal with sexual behavior. I don't need to know what the kids are doing sexually. I need to know they're being safe, that they're using condoms or they're using some protection, that kind of thing. So you're asking a really good health question. I'll see what I can find because Chase Brexton is a great resource. If you just go on Chase Brexton's website, they do a lot of work with LGBT students. And the Maryland Department of Health has a whole LGBT office that has all kinds of information about sexual health. So I would say either those, Chase Brexton or the Maryland Department of Health, and just look under, just LGBT, and you'll find the kind of information you're asking about.
Okay, thank you.
You're welcome.
So another question I have is, adolescence is a time of establishing identity. And so how best do you think we could serve kids that really haven't a clue? They think they're one thing and the next day they think they're another. So that's all part of adolescence, is this discovery.
Mhm.
So how would you, as a counselor, would you recommend that we best deal with that with our kids, so that they know we can be trusted and it's okay not to be certain one day? It's okay.
That's the answer. And we let the kid, we go on the journey with them. I often say that to kids when I'm counseling them. You don't have to know. What you can know is, I'm on this journey with you, and I will stay by your side on this journey. And today you might identify as male, and tomorrow you say, no, that's not it either. And that's fine. That is perfectly normal. That's just exactly what you said. You're already, Kathleen, answering, already giving good advice. And then if in fact you have a counselor who you feel is really sensitive to these issues, then we want to make sure that you ask them if it's okay if you talk with the counselor, and see if maybe the counselor can sit down and have a little more time with them about the social emotional issues around this whole questioning. Many of our kids know for sure, they just don't know what it's called. So that all the kids I've worked with have said, I always knew I was different. I didn't know that meant I was gay. I didn't know that meant I was lesbian. I didn't know that meant I was transgender. And so it's a process, like every process, it takes time. Any other questions? Assuming you're checking the chat just to see.
I am.
Yeah, I knew you were. I could tell.
Sorry.
No, it's good.
So are there any other questions? Let me, last call for questions. Well, Lynn, I haven't gotten anything, but I would like to thank you.
Sure.
And I'd like to put in a pitch to all the people here. April 14th, 2021, we have another fabulous webinar on diabetes management in the school system.
Good.
And I also want to put in a pitch for our annual conference that will be virtual. We have some dynamite speakers lined up, some COVID related, some just school health related. I hope you all make an opportunity, and it's going to be a virtual format on Monday, May 17th, with follow-up at the end of the week. So please, please join us at the annual conference. It's going to be amazing.
Thank you.
And Lynn, I do want to thank you for your time. It's been a very informative and enlightening conversation. Most important to me is not realizing that what I see is just the tip of the iceberg, and it would help open up the aperture when I